I'm Dr. Jeff Brown with the Merge Medical Podcast with my very talented co host, Dr. Jeff Cole. We're joined today by the CEO and founder of MedSender, Salman Haque. MedSender is a service as a software platform that uses artificial intelligence to automate what would otherwise be mundane and redundant tasks to free personnel to do other things. It integrates with multiple EMRs and works in any healthcare organization. That pretty good summary, Salman?
Yeah, absolutely.
Tell us about it.
Yeah, so I can give you the first place we started was actually somewhat interesting. We started out as a fax replacement software for healthcare. And a lot of what we do revolves around making fax easier for healthcare. And as physicians, faxing is still a really big problem in all types of healthcare settings. Mm-hmm. The vast majority of medical records are shared over fax. But what we realized as we built out our fax software platform is that it's not just that sharing records is difficult and often has to go over fax. It's that data is siloed in different systems and locations and companies and organizations. And what you have to have happen is a lot of manual work needs to go into both getting that data out and on the receiving side, when you're getting, say, a fax or a document, dealing with that. And that's where a lot of the administrative bottlenecks pile up.
Mm. Well, tell us about your web app. Is that how this technology is deployed?
Yeah, so we have a few different ways organizations can use MedSender, really two primary products. We have a web app, a web application that allows clinics or practices that are using the MedSender platform to interact with our portal in conjunction with their EMR, EHR software for their medical records. And they can go in and edit documents, send and receive faxes, and see things in a very clean, easy to understand user interface. We do also have an API product that's more geared for enterprises, so that if you are a digital healthcare company or, let's say, an EMR vendor yourself, you can integrate some of this capability built into your own applications.
And how did you come about discovering the need for this?
So myself and all my co-founders, we all have various sort of healthcare backgrounds. Actually, I think so. My colleague, both of us come from families of physicians, so been in and around healthcare our whole lives. We were pre-med at some point in college, and then interacting with doctors, shadowing, those sorts of things, figuring out that the way that records and data is shared in healthcare just ends up requiring so much work and creating problems, both in terms of inefficiency, but also just actual errors and issues that go far beyond just problems of, it takes too long to do something. When medical records are shared, it's not like a legal document where there's just a delay. This really literally can be a matter of life or death. Mm. So in interacting in those settings, we saw that there has to be a better way to do this. And that was sort of a common refrain as we started to build out this platform. And really the current iteration of MedSender, where, we really prioritize not just, digitizing this experience, but actually optimizing it using AI and, structuring this unstructured data. That really came about after just working with our practices and our users that, they're sending and receiving these faxes and figuring out how can we make this experience better for them, and not just streamlined, but actually automated as much as we can.
And I experienced this myself in my practice where referrals just disappear. You said in some of the information you sent us that there's this staggering number of referrals that just drop off, like 40% just disappear. I can see where a primary care physician would want to send someone with chest pain to the cardiologist, and they just it never works. Do you have a comparison of how MedSender compares with how it's traditionally being done? What metric?
Yeah, absolutely. So just to dive a little deeper into that, it is a real problem that referrals often don't result in an appointment. Mm. And, depending on who you ask, that's somewhere between, 30 to 50% of referrals in the US from a primary care provider to a specialist of any type don't result in a scheduled appointment. And there's a few reasons. Sometimes it's just a question of the patient opts to go with a different provider that wasn't referred. Patient, they decide they schedule the appointment, they don't show up, or all these sorts of other things. But a good chunk of that is really just the referral gets lost, as you said. And if you are sending something over fax, it's quite possible that the fax just eventually never goes through because it's going over a very antiquated technology that is actually over a phone line. But then I think what we see commonly is that, the referral gets through, but it gets lost in a pile somewhere, whether that's an actual physical pile of paper or just a digital pile, this inbox with hundreds of faxes. And, if you get to it a week late, 2 weeks late, a month late, the momentum for that patient to see you might be gone, right? They might have gone to someone else, or, they may just decide not to take it seriously at all. And I'm sure you all have seen getting patients to adhere to anything's a challenge. And we hear that from our providers all the time.
Yeah, of course. So it's lost revenue, as well as, like, Jeff, like, wouldn't you agree that if they don't come to the office, there's no billable event? And if they don't come to the office, there's no surgery for you or pain block for me, right?
Yeah. I mean, there's a real need for EMRs to communicate better. And that's not necessarily what you're doing, but I think you're just, when one EMR is trying to send information to another, you're just making sure that happens in a seamless way with low error rate. Is that a fair way to say it?
Yeah, that's another way to look at it as well. Essentially, we started out trying to just replace fax. And what we realized over time is that it's really hard to replace a built-in network. Every physician in the US practically has a fax number, and it is the lowest common denominator. But what we realized is, if we enable a clinic or a practice who uses MedSender to just optimize their workflow dramatically, it doesn't require both parties to use MedSender. So if you're a clinician and your practice opts into MedSender, what we can do is take over your fax, which we see as the natural wedge or starting point of a lot of these administrative workflows. Everything is coming through. In some practices, almost everything is coming through fax. Maybe 50% in some others. But when it comes in via fax, what we can do is run that fax through our AI because it's already digitized. We run the fax through our AI. And these are proprietary models we've trained to do things like extract patient information like name, date of birth, additional demographic info, cell phone numbers, gender, all those sorts of other things. And then we can also classify that document too. So if something's a referral, we can immediately flag it as a referral. If something's a lab result, we can flag it as a lab result. And we can even do things like summarize the document and title it and essentially take what might have been a manual process for an MA or someone in the clinic, 3, 4, 5 minutes to deal with. We can automate that away in seconds.
Are there other competitors on the market, and what would you consider your competitive advantages?
Yeah, so there are a number of fax companies out there, digitized fax companies, and we don't necessarily really consider them as direct competitors. What we see as our advantage are a few things. One is we do have a sort of a pretty broad array of proprietary technology we've developed in terms of both the integrations we created with various EHR and EMR platforms, but also with our particular AI models. These are models that we've trained specifically for medical records, and in particular, faxed medical records. So we're able to achieve a high degree of accuracy using this data and make it so that it's not just something, an inbox you can come in online to and you're in the portal and dealing with, but we can actually automate away the additional steps of filing it to the right patient's chart in the EHR.
So walk me through from start to finish. I send Jeff Cole a referral for hand pain with a patient, and what exactly happens with MedSender?
Yeah, so if you're sending that referral to Dr. Cole and he's got MedSender in his clinic, what we can do is essentially take over that fax infrastructure. So we maintain and host the fax infrastructure. And so when that fax comes through into Dr. Cole's clinic, let's say previously the setup was either one of a few things. It came through on a fax machine, which I hope wasn't the case, but still quite often for a lot of the physicians we work with, they're still on paper. It might have come through electronically through some sort of third-party portal. And again, as I mentioned, there are a lot of sort of online fax portals you can use that don't offer AI or the type of integrations we do. And then the third sort of broad category is it might come into the EMR, into some generic inbox where someone has to still go in and click through every single fax to see what it is, label it, assign it. That's a really common setup. So what we can do is if MedSender is in place, when that fax comes in through our network, we'll run it through our AI. And within our portal, you'll see, okay, this is the patient name, date of birth, what type of document it is. And then we can also automatically file it to the chart. And depending what the EMR is, there's some additional configuration we can do, such as, create a task for the appropriate staff person. So if it's a lab result, we know we want that to go ahead and be tasked to the provider because the provider is going to review the labs. Or if it's, a referral, task it to the front desk because they have to schedule that patient, or, various other workflow rules we can set up.
So it cuts that initial process out and categorizes.
Exactly.
Okay. And it works with you. I think you said it works with any EMR, any of the major EMRs.
So we're integrated with most of the leading ambulatory care outpatient care platforms. We don't do a lot on the inpatient side yet because we think that the real need is on the outpatient side in terms of this administrative bottleneck. And most modern EHRs we're able to integrate if we're not already integrated with already. And that is another sort of key distinction of our platform is we've designed our architecture in such a way that we consider it to be highly portable. So what we mean by that is if we have a platform we're not currently integrated with, our integration timeline is typically measured in a couple of weeks as opposed to months or longer.
Other than physician and provider clinics, are there what other medical businesses? I mean, like an MRI imaging center, or what other businesses make sense for you?
Yeah, absolutely. I mean, we actually do work with quite a variety of different types of groups today. We have a number of imaging and diagnostic centers on the platform. We have some independent pharmacies as well, including one large pharmacy chain. We have some lab companies as well, like clinical reference labs. Really, anyone who's sending and receiving faxes or PHI in any form could be utilizing MedSender. We have some small EMR companies as well on the platform. So really just it's a pretty wide variety of potential audiences we can reach with what we're doing today.
And I can imagine that it's different if what a hospital would say versus a practice, but do you have averages of a return on investment that these entities make when they use MedSender?
It really varies, and the specific audiences, what we're trying to, the way we try to segment. So depending on the clinic, a busy clinic, may be receiving, it's hard to say, but upwards of 10, 20,000 faxes a month. And we've done some case studies with some of our existing customers, and I know for one of them, basically, we've they cut their sort of labor costs or time spent on fax by I think about 4x. So they previously were at the point they were about to have to hire another full-time employee just to deal with fax. And
Wow.
Once they onboarded MedSender, they were able to manage everything just with the existing staff.
I can see so many clinics could benefit from that, right, Jeff? And that's Jeff's wheelhouse is the EMR. He built one before it was popular, way ahead of his time, right, Jeff?
Yeah. 2003.
Yeah.
We got started. Yeah, I wish I had that. We made a couple of mistakes early in our development. I wish I could walk those back a little bit. We ran the company about 15 years, but we didn't find that revenue source early. We continued in so many words mapping the human genome as far as a really deep template library, and we should have paused to figure out how to make those early dollars while we continued to develop on the back end. But that's another story.
How many people, Jeff, do you have at your clinic just to manage incoming data? Do you know?
We have 3 divisions, and there's probably at least 1 or 2 people at each division handling a lot of these tasks. So there's no doubt it's it's a manual process for a lot of clinics.
Yeah.
And there are delays. There are things that get sent to the wrong folders. There's like a lot of things we do, there's just a better way to do it. And so
in your clinic, so you're a bigger clinic. You're saying you've got anywhere from 6 to 8 people that just handle incoming data. So with this process, Salman, you correct me if I'm wrong, you could cut that to 2.
It really depends on your needs. For some of our clinics, for them, they already have employees just overworked and you're spending a ton of time, maybe even on the weekend or a lot of overtime, just catching up on things. So we like to say MedSender gives providers the flexibility to, utilize their team or structure their teams, their staff in the way that makes sense for them, free them up for more important things, things more relevant to clinical care,
Mm-hmm.
or, getting patients in the door, or some of these other things that just may get sort of buried, or just, making sure that there are things that aren't getting lost in the shuffle, like these faxes for referrals, or,
Right.
just getting better at turning around things like a prior auth in time, or
Mhm.
something like that. So
Mhm.
it really depends. I think with our larger clinics, that's where we start to see the advantage in terms of the system being able to really save
Mhm.
time and scale. So we actually recently partnered with or recently onboarded a large outpatient clinic with a couple hundred locations. And at that scale, the problem of dealing with faxes is pretty enormous. So that's where we really see the advantage of bringing in AI into their workflows.
Yeah, that sounds like a great client and partner to have. Do you have any other channel partners that have moved the needle for you as far as just adoption?
Yeah, absolutely. I think that's one of the big challenges when you are building a software platform for healthcare, but in particular for the sort of long tail of the market, the outpatient side. Because we've had people tell us, it's really hard to build a software platform for small to mid-sized clinics. But we actually think, it's a great opportunity for us to reach an audience that really could benefit from this technology. I think some of the really large enterprise health players are certainly investing in automation. But where there is a real need and gap is definitely on the outpatient side. So what we've been able to do is partner with some of the EHR companies out there. So we're able to work with them to tailor what our platform can do, and then also get it in front of some of their users. That way, we can fill a gap in maybe what their existing services are, without them necessarily needing to develop or spend the resources to incorporate similar functionality into their own apps.
So that's an interesting and really sounds like a powerful way to market yourself. You're complementary to an EMR and you're partnering with these entities to make their processes better. Is that correct?
Yeah, absolutely. We certainly don't consider EHRs to be competitors of ours, and I think vice versa. We've had a lot of conversations with a number of EHRs, both ones we're partnered with and ones that we aren't yet. And the reality is that there's just so much to do in terms of their product roadmaps and what they need to serve their customers. That document management, so to speak, is often just something that unfortunately doesn't get the attention they know they'd like to put into it.
For
It's
sure.
always one of those things. As long as it kind of meets the basic requirements,
Yeah.
that's kind of the status quo. And not everyone will need some of these features. Like if you're a really small clinic, maybe you don't get a lot of faxes, whatever it might be. You might not find the extra value in a premium solution. But if they're able to partner with folks, and they do this all the time, is partner with third-party sort of solutions, they're able to address some of these needs, and we're able to come in and keep their customers happy as well, so that they have another tool in their sort of solution suite that they can refer customers to.
And a follow-up to that, when you are partnered with the EMR, what entity is paying MedSender? Is it the practice or is it the EMR or a combination? And just speak a little bit about how you charge your customers and who is the customer in that setting.
Right. That's a great question. So it's really a combination of all of the above. The majority of our customers are what we call sort of direct customers. We contract directly with the end user, in this case, typically a medical clinic. And what will happen with these EHRs is often they'll just refer the customer to us, because that way, we can do our pitch, we could close the customer, handle implementation and support without necessarily needing the EHR to have to go through all of that. So the EHRs like it because it's minimal development work or resources needed on their part. We like it because we can work directly with the customer and make sure their needs are addressed appropriately. In terms of the sort of the flip side of it with the business model, in exchange, we've done some where it's more of a reseller relationship where the EMR is building MedSender into their own app using our API, so that you do have fax built in through that part of the platform. So if you already have a built-in fax module and you're using some other third-party API service, you can use the MedSender API instead, which gets you the fax, but then you also get all the additional data with it if you'd like. So the patient name, date of birth, the document category, etc. So that now if you are the EMR, you could decide to display all of that info in the inbox instead of just a string of phone numbers listed out there. So that's one way it works. We've done some in the past that have been sort of rev share agreements, but it really depends on the company and which way the industry is going in terms of the business model.
You alluded to it, but do you have different tiers, different product offerings, premium down to what perhaps just a smaller clinic would use?
Yeah, so as you touched upon it earlier, we are a software as a service platform. We basically structure it with different price points for different sizes of groups. So really, we try to keep pricing as transparent as possible. We charge based on sort of usage or volume rather than based on the number of providers or the number of staff users. And we have different tiers. So for a small practice, MedSender could start as low as $99 a month with no contract or commitment. So it's a really low barrier to entry to start using our platform.
Wow.
And then we scale up commensurately, just depending on volume, to custom enterprise plans that, will be a product of just how much they're using in terms of fax.
How many faxes per month does $99 get you?
That gets you 3,000 pages a month. So for a small practice, it's generally very sufficient.
Jeff, how does that compare with your practice? Do you know? It's got to be, you're way above 3. You might get that many a day.
Yeah, and I'm proud to say I have no idea. I just want the information,
That's right. Yeah.
It's a problem you don't really think about, actually. And we find this, that's generally the answer I hear. It's like, I have no idea how many faxes I'm getting or receiving.
Yeah, unless you're unless it doesn't work, right? And then
exactly.
That's right.
May's on the phone with the clinic who says they've already sent it twice, and
But that back office is the bottleneck. The referral center, the back office, that's the bottleneck in every single practice, right?
Yeah, it's ripe with inefficiencies, no doubt about it.
Definitely a problem looking for a solution like this. But do you have EMR companies sending you business then?
Actually, yeah, that's when we talked about channel partners, that's typically how it works is, an EMR company, if they partner with us, what we can do for them is, as I mentioned, build out some better features or some more tools for their particular customers. And then if they have a customer that, has this issue, maybe they receive a lot of faxes and the built-in fax tool isn't sufficient for their needs, or they want, sort of some more powerful solutions at their disposal. They might say, we're partnered with this company, and then they'll connect us to that customer. And, there are a lot of different solutions that, they like to do this with. So most EMRs do have sort of a partner marketplace. And I'm sure you've seen some of these pages that they have. So we can work with them to make sure that their customers who might be a good fit for MedSender can find us, get to us, and make sure we show them if we're a good fit or not.
Nice.
How about your technology? Has it been an upward kind of linear growth of it, or have you switched platforms at any point, or still just building on what you started with?
We're really just continuing to build. The product has evolved pretty significantly, but we've always built it with scale in mind. So this idea of building a network platform that can handle millions and millions of transactions a month if we need to. So we've had a few sort of inflection points that we like to think about them. We launched our first AI offerings in 2021, so a little bit ahead of the curve relative to a lot of the stuff that's coming out now. But what we're seeing that's really encouraging is this sort of AI tailwind is really something we're benefiting from as well, because now there's an increasing recognition even from folks who may not have had much experience or familiarity with AI. They now may be proactively looking for it. So 2 years ago, when we said we have AI, maybe there'd be a glimmer of recognition or sort of some understanding. But now we'll actually have people proactively looking for AI-powered faxing or AI for healthcare. They're coming to us, and when we talk about it, they may not understand exactly how it works, but there is an increasing recognition that they know this is something that's out there that they need to be taking advantage of. They just may not know what form that takes.
That's interesting. So that's been a tailwind for you guys, this whole thing.
It's nice to know that you were already there rather than just putting AI in
Yeah,
something.
that's right.
New.
That's right.
Yeah.
All of a sudden,
We've had people comment on that. It's like, you know, it's nice that you haven't just been doing AI for the last 6 months.
Right.
So it is something we've benefited from. I think, you know, like a lot of groundbreaking technology, you sort of have that rising tide raise all ships, and we're certainly feeling that as well.
Yeah, because you guys were doing this. I mean, I think I met you several years ago, and through a mutual friend, we became acquainted. And then I was actually in Springdale, Arkansas, and I saw some paper. It was prepared by MedSender. So, wow, this bright kid's got some business in Springdale, Arkansas, and you were doing AI then. That had to have been 3 years ago, right?
Yeah, so we started, you know, working on or getting the platform to that point. I think so. We launched our first true AI offering in 2021, and you know, continue just to iterate and build out on that offering. So you know, our AI can do a lot more than it could 2 years ago. But you know, now we're able to, as I sort of alluded to earlier, not just extract some of this data, what you call like sort of entity extraction. We can also, you know, summarize, categorize things. You know, we're building out additional automation around that because you know, the more and more structure you add to data, essentially you can do a lot more on the EHR side. So we recently launched a feature that for certain EHRs, you can actually create a new patient chart from within MedSender because we've extracted all the relevant info, you know, patient name, phone number, you know, if they have a you know, contact info we need to put in, we can do that as well.
Are you at the point where you could monetize some of this data internally beyond
Yeah, so
the
we're not.
subscription? Yeah.
Yeah, that's a great question. You know, we take sort of data privacy and security very seriously. As a company that works almost exclusively with healthcare providers, you know, everything we do is designed to be HIPAA compliant, secure. So we're not really, you know, looking at data monetization as a serious strategy. Right now, we're really focused on building out the platform and reaching more providers.
how many? Well, how large is the market, and how much have you scratched that market? In other words, you may not be able to answer this, but how many physicians and/or providers would you say you have on your platform?
Yeah, I mean, it's a fair question. Yeah. So the market, just to touch on that, we think is enormous. If you look at just, you know, some of the top line levels, everyone's heard that sort of, oh, the US spends $4 trillion a year on healthcare. But really, when you break that down, $1 trillion of that is administrative spend. And if you dive deeper into what is that administrative spend, a lot of it is what is on what you could consider or call automatable workflows. Things like back office operations in the clinic, on the payer insurance side, and, you know, in pharmacies, and everywhere in between. And there's a lot of times, you know, there's just inefficiencies created by that workflow. You know, the prior authorization example is one we like to talk about. You know, if you have to prescribe something that requires a prior auth, you know, there's a lot of back and forth that happens, and often it ends up having someone to get on the phone from the practice. They're waiting on hold, dealing with something, you know, spending, you know, half an hour to get this done, and, you know, maybe filling out some paperwork, and it's coming back, it's rejected. You've got to fill out more paperwork, and that's the type of inefficiency that just, you know, at scale should really be automated, or a lot of that is. And there are companies working on, you know, prior auth automation. We think there's, you know, some applications of our AI as well that could be used in settings like that. So, you know, we really do think that the market's enormous. Right now, we're focused on primarily the outpatient and ambulatory care space because we think, you know, the need is most acute there. And also just from a go-to-market standpoint, you know, we can onboard and integrate with new customers very quickly. You know, typically within a few days. Our average sales cycle is 1 week. So we can move really quickly to provide value. And over time, we think we want to continue to move up more up market.
So you said that your software has improved over the years. And so AI, the whole concept of AI it's scary for a lot of people, and myself included. Does your platform, is it learning? Is it getting better on its own, or is this something that you're teaching your platform?
So it's both. It is, you know, there's a lot of training involved. So when you look at or hear about these AI models out there, there's an enormous amount of training that has to go into making sure these models are producing, you know, accurate results. And for what we're doing, it's honestly a fairly narrow scope. We
Mhm.
are doing data extraction and summarization, classification
Mhm.
on medical records. So that does help us. But then in addition to the training, we do have mechanisms for users to report errors or inaccuracies, so that
Mhm.
over time you could say it is getting better. But it's not one of to put some concerns to rest. It's not a sort of sci-fi concept here. That's one to worry about.
Mm.
To take a concept like prior authorization, I can see how the AI would be able to figure out that a particular fax it relates to prior auth, but is it
Mhm.
smart enough to read through there and if it says we need to hear from you by 5 o'clock on the 12th, um, is it smart enough to flag that or put it in a queue with certain priorities?
Yeah, absolutely. That's certainly within the scope of possibility, because what we're able to do is summarize the key information from it. So we're extracting that text from the document, and that's technology that's been around for a long time. OCR, that optical character recognition, but then we're actually running it through these models to understand, what are the relevant points here.
Hmm.
So if it's something that a person can look at and figure out. Um, Generally speaking, these language models should be able to do so as well.
That's fantastic. Huh. Man, anything that helps prior authorizations and
Yeah.
increases the number of referrals that gets to a practice is pretty powerful. And you're talking like most practices would pay $100 a month for this, right? That's fantastic.
How about the team, the founders? What can you say about your partners?
Yeah, so we have a very lean and scrappy team, and that we've been able to accomplish a lot with. So one of my co-founders, Zane, actually, he again similar background as me, comes from a family of doctors, was pre-med in college, and then realized, wait a sec, this is a big problem. Really, he focuses a little bit more on the product than I do. He's my co-CEO, and I spend a little bit more time in terms of sort of strategic initiatives, biz dev, that sort of thing. Um, and then we have a couple of full-time engineers and a person helping us out with customer success. But as of now, it's 5 of us full-time working on the product and the business, and we have some folks helping us out part-time as well. So about 10 in total.
Salman, you're doing great. Tell me about just you. I want to hear about you, your background, what you studied, and that sort of thing. And then Jeff, if it's okay, I want to get into some metrics with the finances, total addressable market, where they are in revenue, funding, and that kind of thing.
To give a little bit about my background, so I was born and raised in Memphis and ended up going up to Harvard for college. And while I was there, was pre-med for about a year and started to learn a little bit more about healthcare and how things were run in terms of the administrative side and the business of healthcare. Ended up majoring in economics, and after college, realized I wanted to start working or building something in healthcare. So I joined a large healthcare startup in New York, and while I was there, I got connected to my co-founders. And this problem of trying to fix or replace faxing and automate it and streamline all of this documentation burden was something that was really appealing.
Mhm.
As I mentioned earlier, I grew up in a family of doctors, so I've seen sort of firsthand over the years how much time that they're spending, in the EHR or dealing with administrative problems, and it just sort of seemed year after year, they're spending less and less time on patient care and
Yes,
more time on paperwork and admin.
100%. Right,
So
right.
every doctor in my family, every doctor I know is sort of complained about some of that stuff. I've met doctors who told me that they retired before trying to merge or move on to an EMR.
Right.
So
That's right.
it's a real problem, and it's something that it seemed like one that I really it was worth quitting everything to work on. And for us, it was one that we thought, obviously there's a huge addressable market here, but it's one we thought that concretely could make a really positive impact for not just patients and not just providers, making their lives easier, but also for patients and enabling them to get better access to care, get things scheduled, and just deal with a
Mhm.
lot of the inefficiencies. One of my colleagues actually has a story where he was helping a relative of his with some medical treatment, and ended up having to drive between hospitals to pick up CDs and paper copies of records because the faxes weren't going through or was too large to fax. So, we all were very aware that there has to be a better way to do things in this day and age.
Love it.
Absolutely. Yeah.
Background again. Is that background good, or do you want more detail?
No, I love it. You are what makes America great. What you are doing, what your friends are doing, is what makes America great. You went out there, you want to build something. Your business will create wealth and jobs for people. It will help patients be better. It will help doctors take care of patients. This is exactly what we want on this podcast. Merge Medical is here to showcase disruptive healthcare startups where it's a win-win-win. We help patients, we help build wealth, we help doctors be financially empowered. This is exactly what we want. And your background was fantastic.
Yeah.
What can you say about your potential, the addressable market we've touched on, but what where could you guys go if you hit on all cylinders?
Yeah, so as we touched on, the addressable market is enormous, not just on the outpatient ambulatory care side. We think that market's quite large. There's, it's hard to put a real number on this, but there's, likely more than 100,000 medical clinics in the U.S. But beyond that, anyone who's interacting with healthcare data could be a customer of ours through our API. So you could use MedSender, even if you're not using faxing, to structure unstructured data, whether that's a document, a photo of some type. We had one EMR company ask us if we could take a photo of an insurance card or something, or a driver's license, and grab that data and put it in the EHR. And that's something like that is well within the realm of possibility. So we think the market there is quite large in terms of MedSender specifically. If we hit on all cylinders, we do believe that it's possible to build $1 billion business just by serving these different facets of the market.
What's your current revenue? What's your run rate? What's your annual revenue look like?
Yes. Yep. So we've exceeded $1 million in run rate as of earlier this year, and we are on track for profitability without another raise within the year. Maybe a little bit sooner, or maybe a little bit later, but we're not actively in a sort of fundraising mode right now.
Great. I've had numerous individuals who ultimately exited successful companies tell me the first $1 million is the hardest to make. So congratulations on that path. Nice. I'll tell you one thing that in Memphis, I get jealous about the experience people have when they go up to Cleveland Clinic or Mayo Clinic, where there's just so much better communication between the various subspecialties.
100%.
And I think that's just, it's an open lane for somebody that just can figure out how individual practices can communicate better with each other. And I think this is a start.
Yeah.
There's so much more, and I don't know how you do it, because all the EMRs, they're different. They don't necessarily play well when two EMRs want to talk to each other, but there is the concept of just there being this layer that sits over the individual EMRs and somehow makes communication better one to another.
Yeah, I mean, interoperability is a fun buzzword, and you hear it a lot. And there's some sort of there are some standards out there here or there, and people will talk about FHIR and HL7 and some of these things I'm sure you all are familiar with. But at the end of the day, the way we like to look at it, or the way that we sort of see it, is the way that these things are implemented quite often doesn't really work for people in reality. So the way certain EHRs have things implemented may not be the best fit for actually how the practices are operating. So something we think about quite often. The healthcare landscape is one, I think, of all sectors out there, it might have the most variance of any in terms of technology. As you sort of alluded to, there are organizations out there that have really robust systems and technology to make things like sharing records within the organization really simple. You gave the example of a group like the Cleveland Clinic. But what we think is one of the big challenges is that it's great that they have that type of technology, but it's unfortunate that smaller clinics all across the country don't get to benefit from that same type of technology. So we think there's a great opportunity to sort of level the playing field and allow anyone to take advantage of tools like that. It's the way I sort of phrase it sometimes is, the cutting edge in healthcare is truly amazing, both in terms of clinical operations and clinical technology, but also some of the tech around practice management and some of these custom things that have been built are really slick and smooth, patient messaging, engagement, and all of that. But the lowest common denominator in healthcare is very low, and I think that's where MedSender could come in.
Well, we sure appreciate you being here, Salman. This has been a fantastic, enlightening interview with you. I've been your host for the Merge Medical podcast, Dr. Jeff Brown with Dr. Jeff Cole. Salman, thanks for joining us. This has been great. Thank you so much.
Thank you both. This has been a pleasure.